All right, welcome. We're going to start here with Chapter 2, the well-being of the EMT. As we all know, the first and foremost priority for the EMT is your safety and health. And that's one of the reasons why they put this chapter right at the beginning, to emphasize how important it is to make sure that you are healthy and safe. That includes not just physically, but mentally, emotionally, psychologically. It's all very important for us to be able to take care of ourselves and to recognize signs when we're not. And to know a few other things, like there's some diseases of concern that we may be exposed to. And so we got to know how we take care of ourselves as well. Let's jump right into it here. Let's see, what we're talking about are well-being, personal protection, some diseases, as I said, emotions and stress, and scene safety. All right, so it's incredibly important to keep our well-being on the forefront of our minds. We need to know that we're safe, we're doing the right things for ourselves and keeping ourselves healthy. And so we should know what the risks are that could be coming down the road. So we can prepare for and take care of things like that. If you're not well physically, or mentally, psychologically, emotionally, you may not be able to give the best care that you could to a patient. So it's important to be mindful and always stay vigilant in monitoring your own health. If you get hurt on a call, obviously you may not be able to take care of a patient if you get hurt on a call, but if you're suffering psychologically, you may not be able to respond either, or respond very well. So again, all these things matter to us. Some steps in maintaining well-being is maintaining solid personal relationships. Obviously, family, friends, things like that. But as you get into the EMS system, you'll notice you should try to build and foster relationships with those that you work with, because if you don't have family and friends in the medical services, it may be difficult for them to relate to something that you're going through. If you've had a particularly tough call, they may not be able to relate to that. And so maintaining solid relationships with people that you work with could be important, because you may be able to lean on them and their experience in getting through difficult calls. Exercise, obviously we want to be a bit fit, and being an EMT, we have to lift patients, we have to get in some awkward positions, and use strength sometimes, and so it obviously helps to be fit. And exercise is a stress reliever as well, so it's an important tool in our toolbox that we should all be using. Sleep, can't say enough about getting good sleep. It's one of the most important things that we can do for ourselves. If we're getting regular sleep, if we're not sleep deprived, then we can operate, our brains can operate on an optimum level. If you're depriving yourself of sleep, or the amount of sleep that you need regularly, then you just won't be able to access and recall information as well. You won't be able to remember things as well. You'll never reach your optimum level of performance if you're just not sleeping well. So it is really important to maintain a good sleep schedule and to be vigilant about that. We all know the importance of eating right. It keeps your body healthy. It's incredibly important. And obviously limiting alcohol and caffeine. Caffeine can affect your sleep schedule, can go so far as to prevent your brain from getting into the deepest levels of sleep, and not permit you to dream and things like that. Limiting alcohol, obviously, don't be drinking on shift, and maybe don't tie one on the night before as well. You need to show up ready to go on the ambulance to be able to give your best possible care. And now, as you're entering the EMS world, we have to make sure that we're getting regular physicals. It should just be a thing that you do every year, physical every year, and absolutely make sure that you are up to date on your vaccines, including especially the vaccine that you should be able to get from a healthcare employer, which is the hepatitis B vaccine. So you definitely want to get that. We'll talk more about that in just a second. Standard precautions, there are steps that we take to protect ourselves from pathogens, or bacteria and viruses from the outside world that can enter our body and get us sick. So some of your most basic standard precautions is like wearing gloves. It used to be almost just wearing gloves when you're going on a call. That would be the standard thing that you wear. But obviously nowadays we're wearing masks everywhere we go as well. Now standard precautions will may be different from call to call. If you have a patient that is has copious amounts of bodily fluids exiting their body for one reason or another, the standard precautions for that would be different than a patient that maybe just stubbed his toe. So it is a case-by-case basis, and you'll need to use your scene size up in protocols to figure out what you need to wear. OSHA, as we've talked about, the Occupational Safety and Health Administration, they have strict guidelines about precautions in the workplace. This can be seen in many industries nationwide, but there are particular applications for us when it comes to bloodborne pathogens, airborne pathogens even as well, and what happens in the event of an exposure. And those kind of rules trickle down. You get to see them in your protocols, your local protocols about standard precautions and what you should be wearing there. Your health and safety is priority number one. Always wear PPE. There's nothing wrong with choosing to wear too much PPE. Be smart about it. If you're ever in doubt, wear it. You know, as I've said to you guys, one of my rules in EMS is that when I step off the ambulance, I'm ready to go the moment I step off. And that includes wearing gloves. So don't even get off the ambulance wearing gloves. Just always wear it, make it a habit. Here we can see some regular PPE. We have some goggles, a surgical mask with a face shield. We have the N95 and HEPA filter respirators, and then we have some standard types of gloves. It can be vinyl, non-latex, rubber, nitrile, and some other type there as well. So let's talk about PPE here. It stands for personal protective equipment. Obviously, we use gloves on every single call with every single patient. They should be non-vinyl, or excuse me, they should be vinyl, nitrile, non-latex gloves. Basically, they can produce allergic reactions in patients. And as a healthcare provider, if we wear them enough, we can develop an allergy to them as well. Hand cleaning, hand washing is one of the most simple and effective ways to keeping yourself safe. Even if you wear gloves with patients, you should, or excuse me, even though you do wear gloves with every patient, after you take off your gloves, you should wash your hands. They're not 100% foolproof. There may be microscopic holes that allow pathogens to get onto your hands. And obviously, we want to be safe in how we control pathogen exposure, and one of the best ways to do that is washing your hands thoroughly. It should be done for about 20 seconds. Soap has a chance to work and actually get everything off of your hands. Alcohol-based hand cleaners are good in the absence of soap and water. And with soap and water, it can be hot or cold. Water doesn't matter. They are good to be there. They're considered effective. Then again, they can be used in place of soap and water when it's not available. But if you have the choice, wash your hands with soap and water. All right, eye and face protection. So we talked about a couple of different PPE pieces of equipment there. So like the safety goggles, we saw the masks, we saw the mask with the face shield included. Eye protection prevents fluids from spraying or splattering, splashing into the eyes and the mucous membranes there. And if you're wearing goggles, that they're going to have to protect from the front and the sides. They can even fit snugly to your face. So glasses like these, regular eyeglasses, do not count as safety goggles or eye protection. They do not count. So if you wear eyeglasses, you'll have to either take them off and put something else on, or some even fit over top of goggles themselves. Here we see an EMT looking sharp in her uniform, and she's got her eye goggles on and a mask as well to protect herself. The masks, obviously, they help for spraying, splashing fluids as well. If we're looking at blood, well, we're going to be wearing these all the time nowadays. But if you're looking at spraying or splattering blood, then these are good. In cases where you suspect the patient will have tuberculosis, TB, which we'll talk about in a bit, you should be wearing an N95 or a HEPA, which is high efficiency particulate air respirator. Those are made to prevent pathogens like tuberculosis from getting through the mask and will help keep you safe. Here's our gentleman. He is suctioning our EMT and a patient of his. He's suctioning out his airway. Notice the PPE that he has on. He's got the surgical mask with the face shield, and he's wearing gloves. Now, this patient looks like he's just throwing up a little bit. It's not projectile vomiting or anything else. So it looks like he's got just enough PPE on there to keep him safe. We also have gowns. You're going to wear these where patients are expelling, for one reason or another, copious amounts of bodily fluids, and it'll protect your clothing and bare skin from being splashed or getting fluids on them. Let's talk about a few diseases of concern. Hepatitis B and C. Hundreds of healthcare workers a year used to die from these diseases. It's a disease that causes inflammation of the liver, and which will eventually, long down the road, most certainly have something to do with your death. It's dangerous in that it can live in dried blood for several days, and so this just goes to show that being thorough in your decontamination and your cleaning is incredibly important. Hepatitis B, it is deadly. Like I said, hundreds of healthcare workers a year would die from it, from exposures. But luckily today there is a vaccine from that. So it is super important to make sure that we get that as healthcare workers. There is no vaccine for hepatitis B. You need to know the difference. You need to know which one does have a vaccine and which one does not. All right, tuberculosis. It's a respiratory illness that affects the lungs. It's very contagious. It's spread through the air, through aerosol droplets and larger droplets when somebody coughs, speaks, sings, yells, things like that. And it is, go back to that, it is deadly. We know that where there is more like dormitory style living is where the tuberculosis can pop up. So we're talking about like homeless shelters, jails, prisons, even old age homes that may not be run well, and so the levels of hygiene may be lower. They can have spreads of this too. So any kind of living area where there's lots of people living kind of on top of each other. And so this is really dangerous. AIDS. So AIDS starts out as HIV, so human immunodeficiency virus. It attacks the immune system of the patient and it leaves them almost defenseless against pathogens in the outside world. And once the immune system has been attacked enough, HIV becomes AIDS, which is acquired immunodeficiency syndrome. And basically, when somebody dies of AIDS, they're actually going to be dying. Something else is going to kill them. It might be something like a flu, cold, pneumonia, things like that. Their body is just unable to defend itself from these pathogens. This used to be a death sentence. Late 70s, early 80s, when you got HIV, it was a death sentence. There was nothing you could do. However, advances in the last 40 years have brought us to the point where you can live a very, very long, healthy life. In some cases, with some patients, it's almost impossible to detect in their bloodstream, like Magic Johnson, for example, is one of those patients. It's almost impossible to detect it in his blood. So we've come a very long ways from it being a death sentence to something that, with proper treatment, you can live a long and healthy life with. Acquiring AIDS, being exposed to AIDS for healthcare workers, there's a lower risk for us in being exposed to that versus hepatitis or tuberculosis. Obviously, tuberculosis is highly contagious because it's airborne. Hepatitis lives in blood, dry blood, for several days, which AIDS does not. The HIV virus does not last long outside of the host. So we're more at risk of getting hepatitis or tuberculosis. In spreading it, the contact with blood is the usual route. So if you're an intravenous drug user and you share needles, there's a needle that is used to get IV access into a patient, and then you accidentally get stuck with that, and that could be an exposure route as well. All right, let's talk about some emerging diseases and conditions. Ebola is a bloodborne disease. It actually made its way over to the U.S. in 2014, and we're very lucky that because it is so deadly and it is highly contagious, that I think it was just a handful of people, possibly 2 people that had died. I'll have to check my number on that, but it was very low. People that died in the U.S., and they got some good work in studying for cures for that. It's basically a hemorrhagic fever. What it does is when you have this, you get a really bad fever, but you also start bleeding from everywhere. So all of your orifices, all your internal organs, all of your blood vessels, they start bleeding as well. So you basically bleed out, and that's how you die. The mortality rate for this was very high. Well, if you got it and you died from it, that was the usual thing. Because of lack of definitive treatment for it. But again, good progress was made in 2014 when it made its way to the U.S. We have a couple of respiratory diseases here. We have SARS, which is severe acute respiratory syndrome. Again, it's spread through respiratory droplets, as most respiratory illnesses are. We have Middle Eastern Respiratory Syndrome. It's named that because it's primarily found on the Arabian Peninsula. You also have the avian flu, or the bird flu. It's found in poultry, and it can affect humans. So it's zoologic, meaning that it can be passed from from animal to human. Human to human transmission is much more difficult. So luckily, because this can be a deadly flu. Influenza has been around forever. Hundreds and hundreds of years. In 1918, the so-called Spanish flu pandemic killed between 30 and 50 million people around the world. And actually, the flus that we go through nowadays, different viruses or strains of the flu that go around, are actually descendants of this Spanish flu there. So luckily, not as powerful as before when it ignited a pandemic. So as far as infection control goes, we're obviously at higher risk than the general public in coming into contact with communicable and infectious diseases. And so we have to be aware of that. There's a lot of guidelines in place to help us stay safe. They are local, state, federal guidelines developed by OSHA and other agencies there. So let's say that we do get exposed. We have OSHA here. It's a joint responsibility to prevent it between the employee and the employer. The employer, they provide training, PPE, and vaccinations to the employees. However, it's the employee's responsibility to employ the training and use the protective equipment and actually go and get those vaccinations. Make the appointment and go. It's free for us. So that's all you got to do, but it's up to you to do that. So an employer can give you all the training in the world about this, but if you don't follow the training and use the equipment and you get exposed, well, that's on you. So it is a joint responsibility. So every healthcare agency, rescue squad, that kind of thing, has an infection exposure control plan, which employees should be educated on. We should be able, as we said, provide you with hepatitis B vaccine, personal protective equipment. And then there's different methods of control that include housekeeping. How do you clean your ambulances? How do you clean your ambulance bay? The inside of the rescue squad and places where people gather. It's important because we're obviously going out into the world and possibly being exposed to some of these things, but how do we make sure that it doesn't follow us home? So if there is an exposure or suspected exposure, there are rules, and we'll talk about that when we get to the Ryan White Care Act, about what you do, how can you report it, how can you get medical evaluation and follow-up with that. Here we are, here's the Ryan White Care Act. Ryan White was a teenager in the 1980s who contracted AIDS, not because he was one of the population that was seemingly getting it a lot, which were drug users, intravenous drug users, using needles, and gay men. He was a young, white, suburban teenager that got it, and he got it because he was hemophiliac and he was getting a blood treatment. And there was a blood treatment he was getting was tainted with HIV. He eventually died of it in 1990, I believe. But before he died, he became an advocate for AIDS and the victims, the patients that suffered from AIDS. And what came of it, of his advocacy, was the Ryan White Care Act. And it allows us to find out if we've been exposed to potentially life-threatening diseases while we're giving patient care. That's great to know, isn't it? Like, if we've been exposed, not only will we find out, but we'll get the care afterwards. Each EMS agency is going to have a designated officer, or DO, that is going to be in charge of gathering the facts about potential exposures there, and they'll let you know. They'll also coordinate your health care there. There's two notification systems. There's an airborne disease exposure, which you may not know your patient has, like, let's say, tuberculosis, but they would find that out at the hospital, and so then they would notify you later of that possible airborne disease exposure. You would find that out afterwards. Bloodborne or other infectious disease exposures, that's a little different because you're probably going to know when it happens. Either there's an accidental needle stick, or you had an open cut on your arm and blood splashed onto it, or into mucous membranes on your face, like your eyes, your nose, your mouth, something that you would know. And so you would report that first, or when you get to the hospital, and start the ball rolling there, rather than the hospital starting the ball rolling with the airborne disease exposure. Once you're notified, the employer will refer you to healthcare providers for evaluation and follow-up there. So you'll get tested, you'll get on any medication and the course of medications that you might need, depending on what your exposure was there. So once the ball gets rolling, you get taken care of, and this is all because of the Ryan White Care Act. So we need to know what the Ryan White Care Act is, and understand the difference, what it does for us, and understand the differences between the notification systems. There's a tuberculosis compliance mandate. There's respiratory standards. So basically the masks, there's a selection and use of masks. The N95 and the HEPA respirators are good for using with TB, so we need to know that. And then we should be using them when we're caring for or transporting a patient suspected with TB. We can either put the mask on ourselves or the patient or both. That would be the best method there if you can. So again, as if we're caring for a patient that we suspect has it, wear the N95 or HEPA filter. All right, there's many immunizations out there that we can get, including for hepatitis B and other infectious diseases. They should be available through your employer or who you volunteer with at the EMS agency. Normally, when you join an EMS testing agency, you get a TB test to see if you've ever been exposed to it. If it's just a small shot kind of under the skin there, and if it swells up just a little bit, it means there's antibodies doing their jobs in your body, and that means you've been exposed to it. So that's a normal test that you get in starting to work in healthcare. All right, let's talk about emotions and stress. So stress is an inevitable part of our lives, and it's absolutely an inevitable part of the EMS profession. We deal with a lot. Call volume, meaning the number of calls we can have to handle in a day. We can see some pretty bad things that aren't part of what you see in a normal life there. And we have to do some things that could be stressful as well. And so being able to recognize stress is incredibly important. And so not only recognizing stressors in your life, but developing plans for yourself to deal with it is incredibly important to not just, it's a good skill to have in life, but it's incredibly important to be able to do that and develop those strategies, deal with stress effectively, so your career can be as long as possible. A lot of people have left the EMS because of the results of stress. The first stage of stress reaction is the fight or flight reaction, or the alarm reaction. This is where it is affecting your body and mind the most. You get all the signs and symptoms of it, the heart racing, the breathing deeper and faster, being nervous or scared, and things like that. Second stage would be coping. It's the silent stage of resistance. So the same stressors that before gave you that alarm reaction, it doesn't really affect you as much anymore. Your body and mind are getting used to it there. And then there's the third stage, and it's exhaustion or burnout. And you just can't resist, or it's bad. You're not as good as adapting to the stressor anymore. And that usually happens over time. So first stage, the second stage happens over time, third stage happens further down the road from that. So stress obviously can happen because of a critical incident, like a particularly bad call, and it's any situation that's going to trigger a strong emotional response. About acute stress reactions. These are often linked to catastrophes, like large-scale kind of things. However, they absolutely can be related to small-scale things, like what happens to one patient rather than many. It can happen with EMTs and the patients, obviously. And then signs and symptoms of being this stressed out happen soon after the incident. It's not way down the road. It's soon after the incident that you get the signs and symptoms there. That can be physical, cognitive, emotional, or behavioral symptoms too. They can run the gambit. And these are normal reactions to extraordinary circumstances. Okay, so it's not often that you see, many patients involved in a large traumatic accident, and so those are all normal reactions, what we normally go through when we have to deal with something like that. And it could affect you for a long time and may require professional professional intervention. Now, this is the first time we're going to speak of professional intervention. So I want to say that there is a stigma in EMS, fire service, police, all these kind of things where we're supposed to be tough and macho and all get through it. But if you ever feel that you're having stress reactions or depressed or anxious about things because of a call, it is absolutely the right thing to do to get professional intervention. If you need professional help in dealing with things psychologically, mentally, emotionally, it is absolutely a good thing to do. Don't think otherwise. Don't be afraid of it. It's like going to the doctor because some part of your body hurts. It is absolutely a tool that should be readily available for you in your toolbox. So don't be held back by what others may think of it, or if they say, you'll be fine, things like that. Sometimes we need help, and it's okay to get that. A delayed stress reaction type is called PTSD, or I'm sure we've all heard of that, post-traumatic stress disorder. And the signs and symptoms of this may not be around for a long time after the incident. And so because of the length of time involved, it may be difficult to recognize where these stress reactions are coming from, since the incident was so far beforehand. We may not recognize what is causing the problem. If you're dealing with PTSD, you should get professional help with that. Okay, that requires an intervention by a mental health professional. And again, there's absolutely nothing wrong with doing that. Don't be stigmatized. Don't think that you don't have help. Don't think that there are not people there to help you, because they are. And it is a good thing to do. Me too. There's cumulative stress reaction. This is a burnout. It's years of sustained, or it doesn't have to be years, maybe months, low-level stressors. The early signs of you have vague anxiety, emotional exhaustion as well. And then it progresses to, there's physical complaints. You're tired, you're sore, you're hurting, loss of emotional control. So maybe you're on edge all the time, quick to anger, having a short fuse, irritable, and depressed. These are all just clear signs of burnout, right? That cumulative stress reaction. People can socially withdraw. You can have people not showing up to their friends or family's houses. They withdraw from their lives. It can progress to suicidal thoughts, ideation, and then obviously those types of things require professional mental health intervention. So there's, this section's a little silly. It causes of stress. Any call in EMS can cause stress. Here's a big obvious one: multiple casualty incidents, or an MCI. An example of that might be a bus overturns, and you get there and there's 40 people scattered on the road. They've all been thrown out of the bus, or there's 40 people laying on top of each other inside the bus, right? Lots and lots of people. So examples of that might be like the Boston Marathon bombing, 9/11, et cetera, et cetera. Calls involving infants and children are stressful. They can cause lots of stress, especially if there's severe injury or even death involved. Severe injuries to anybody. Calls involving abuse and neglect can be incredibly stressful. The death of a coworker in the line of duty, things like that, are obviously really stressful as well. Let's talk about some signs and symptoms of stress. Let's make clear a couple of definitions here first. So stress is any outside kind of influence on you. Stress, the word stress itself in this medical context, does not denote whether it's a good thing or a bad thing. Okay, it's kind of a neutral thing. It's an outside influence, like, on you. Now, when we talk about this next term, eustress, that's a good stressor. It's a positive form of stress that helps people work under stress and perform effectively. It would be like if you're doing something difficult and your boss says, hey, you're doing a great job. Maybe it's an outside kind of influence on what's going on, but it helps you in the moment, like, oh, all right, the boss thinks I'm doing a good job. Like, I can keep doing this, and it helps you respond effectively. That's eustress. It's a good form of stress. And then there's distress. Distress is what we think of stress when we hear that word in our normal everyday lives. This is a negative form of stress, and it causes short-term and can cause long-term problems with health and well-being, and it, obviously it's going to affect the way you work under pressure and responding effectively. I'm sure we all get a little bit irritable when we get stressed. Sometimes it's hard to concentrate. Maybe there's changes in daily activities if you're incredibly stressed. Maybe you're not going to bed until incredibly late. Maybe you're sleeping in when you should be getting up. Maybe you're not eating as much. Maybe you're not going out and doing the things that you normally do. It can produce anxiety, indecisiveness, feelings of guilt because maybe these changes in your daily activities, your irritability, your inability to concentrate, maybe they're affecting your job, or maybe you feel like it's affecting your job or your relationships. And so now people can feel guilty about what they're going through. And then people can self-isolate. They can withdraw from their lives, basically, their friends, family, coworkers, that sort of thing. And then loss of interest at work. This you're going to find in a lot of people who are suffering from burnout, which is fortunately not an uncommon thing in EMS. Lots of people suffer from burnout, and you can see it, how they interact with patients, how they help clean up around the house, how their interactions there at work are. So loss of interest in work is also a sign and symptom of stress. Sorry, coffee. So what do you do if your partner is showing signs and symptoms of stress? Do you reach out to them? Do you talk to them? Do you let them say, they'll handle it, they'll be fine? What kind of risk do you think there could be to you or your partner or patient if stress is left unresolved? Say you're going through burnout and you don't deal with your stress effectively, and so you're just kind of in a rut in this burnout. Is that going to affect your patient? Could it affect your relationships with your coworkers? Think about that. If your partner is going through something, do you have an obligation to act, to try to help? Like, how do you think that would go? I mean, a lot of people are like, well, I want to mind my own business, that kind of thing. So it may be difficult to do that, but what do you think? Do you have an obligation to help? All right. How do we deal with stress? Let's be zen like the dog there. Work on lifestyle changes. That means like healthy and positive attitudes. Like go to sleep at a regular time. Don't drink coffee like after some point in the afternoon or evening, so you can go to bed. Eat right. Be more intentional about your food choices. Get exercise. Relax. What is it that you do to relax? Like, can you get more time doing that? Can you help yourself out? Maybe it's like call volume. The number of calls you get is overwhelming for you at the moment. Can you go ride at a different station where call volume is less, or there's different types of calls? Can you get more family time or time with your friends if need be? CISM, or critical incident stress management. It's a system by which we help ourselves deal with stress, and by ourselves, I mean our EMS family. So if there is a particularly bad call, when the CISM occurs, you're offered the resources to be able to deal with it. And so whether that's professional help in counseling or having peer support groups, things like that, to help you through those things. And you get education and training and resources on how to prevent and deal with stress. So after a critical incident, like particularly bad incident with CISM, the first thing that happens is they're kind of what's called like a hot wash. So it's a debriefing. So everybody involved in the call will get together and talk about what their roles were and maybe how that affected them on the call. It helps us to get things off of our chest, to relieve some of that stress. So like it says here, it helps us to diffuse a little bit. There are peer counselors and professional mental health professionals that can be brought in to help with this. And speaking from personal experience, it's incredibly helpful. And you should be able to get access to them within 24 to 48 hours of the incident occurring. So death, which is very real and very much a possibility. If you're in EMS long enough, it's only a matter of time before a patient dies. It's just kind of the odds. And so we have to understand reactions to death and dying. You don't usually see dead people around, and it's not normal, to watch somebody die or to see somebody die. And so these are kind of extreme events in the course of everyday life there. And it is one of the most difficult parts of the job is seeing somebody die, especially when you're giving all you can and they happen to pass. Dealing with patients' family members that have died can also be incredibly stressful. And in understanding death and dying, we've got to understand that there's emotional stages. There's denial, like it's been happening, anger, why me? Why does this have to happen to me? Bargaining, like, okay, I get it, I'm dying, but let me get this done first. Depression, they're like, oh man, all right, I'm dying, but I didn't even get to go to the Bahamas on that vacation I wanted to go to. And then there's acceptance. Now, not everybody goes through all 5 stages, and not everybody goes through these stages in this order. But somebody will usually hit on something in there. It's important to understand these 5 emotional stages. So when caring for a patient that's dying, obviously you want to recognize the patient's needs, and comfort, and be tolerant of family members' angry reactions. They may not understand what we're doing and the procedures, steps, and interventions that we have to undergo and take in order to try to take care of their loved one there, and they may not understand all of it. So be tolerant of their reactions. After all, they just lost a loved one. Try to listen empathetically. Put yourself in their shoes. Try to feel what they're feeling, and be present for them. Never falsely assure anybody. You just want to get the phrase "it's going to be okay" out of your system. We really shouldn't make a promise like that, especially to a patient who we don't know that it's going to be okay, or we know that it in fact will not be okay. Don't falsely reassure people. Offer as much comfort as you realistically can. Ma'am, we're doing everything that we can to help you out. Something like that. Don't tell them that it's going to be okay when you don't know that. So offer reassurance, but only as far as you can go. All right, let's talk about scene safety. So our priority, number 1 priority is our health and safety. So scene safety is paramount into accomplishing going home safe. Now, EMS is not usually a dangerous profession, but we can come across dangerous situations. For example, working on the highway is one of the most dangerous places that we can regularly work at. Every year, firefighters, police officers, and EMS personnel get struck on the side of the highway, or the vehicles get struck and they get injured or killed. So you need to be aware that potential dangers are everywhere, and being aware of that and being vigilant about it is always a priority in order to stay safe. Determining that you're safe is always going to be your most important decision. And it's not a one-time decision either. Scene safety starts basically when you're getting in the ambulance and you're responding to the call, and it ends and you're done. And you're done with the entirety of the call. It's an ongoing decision. Things can change. They can be fluid. And so you need to be aware that scene safety is an ongoing decision, and it's the most important one that you can be aware of. Hazardous materials incidents. Primary rule for hazardous materials, and we'll get into more of that later in the year, is to maintain a safe distance. There's placards on trucks and tanks and all sorts of things that will tell us what exactly is in there, how dangerous the chemical is it, for example, flammable or explosive. And every ambulance should be equipped with binoculars so you can look from a great distance away and see what is in there, what could possibly be let out into the environment for hazmat response there. We're going to get to know our emergency response guidebook, or the ERG. Probably seen it in the classroom bookshelves. They're the orange books there that we have. And these will give us basically our protocols for how to deal with different volatile chemicals and whatnot, different hazardous materials there. It'll let us know what our responses should be. For example, how far back should we be from the scene to ensure our safety. So our role as an EMT, we need to be able to, in a hazardous materials incident, we need to be able to recognize potential problems. We need to be able to take actions for our personal safety and the safety of others. For example, bystanders. We need to clear an area out. Tell people to get out of there. Point them in the correct direction to egress, to leave the scene there. So we have to be able to recognize the problem and take some actions there, and notify either the trained personnel themselves or our dispatch center saying, hey, we have a hazardous materials, we need a hazmat response team here. And this is super important for us in maintaining our safety and health. If a patient has been exposed to chemicals there and they are contaminated, they have to go through a thorough decontamination before we can be hands-on with them and provide patient care. That's the way we keep ourselves safe. All right, terrorist incidents, they can be large or small. So obviously 9/11, and like the Boston Marathon bombings, those are terrorist incidents from a large to a kind of medium scale there. They can also be smaller. They can include chemical agents, biological warfare agents, radiological agents, and explosive devices. So they can employ all sorts of tactics to meet their goals there. And we'll get more into that later in the year as well. Rescue operations often involve other agencies, cross-training as like a firefighter and high-angle rescue operations and things like that. So proper extrication techniques. So it's rescuing or disentangling people from fires, car crashes, explosions, electrocutions. Maybe they're stuck up high on a tower. Maybe there's swift water rescue as well. So maybe somebody's swept down a river, or they're stuck out in the ice on a pond or something like that. All sorts of different rescue ones. And they all require specialized training. Evaluate each situation and ensure that the appropriate assistance is requested early. That's going to be part of our scene size up that we talked about, is recognizing when we're going to need help. And so reaching out to dispatch, letting them know what's going on early is the best way to go. Violence, you got to be aware of violence, wear safe clothing, make sure that your equipment isn't so cumbersome, that you're carrying around tons of stuff in your pockets and everything else. Speaking of equipment, if there was ever violence and you needed to retreat from an area, just drop the equipment. It's not worth carrying. It's going to slow you down and result in you getting hurt. We always want to carry a radio whenever possible so that we can be in contact with not only our other crew members, but also dispatch, and you can call on radio for help. You can decide on safety rules. Here we see a standard precaution for standard safety precaution for knocking on the door. You should never stand right in front of somebody's door and knock on it. The reason for that is, what if they're waiting behind there with like a gun or a weapon, and once you knock on the door, they shoot through it. So hopefully, standing to the side, as these two gentlemen are, will help keep you safe. You have to be vigilant and observe, so you can start your scene size up on your approach to the scene. So that means if we're going to a house in a neighborhood, I'm starting my scene survey when my scene size up when we get to the neighborhood. Not when we get to the house, but when we get to the neighborhood. You know, when I'm taking as much information as possible. If you know that there is violence has happened, normally what's going to happen is police will go there first and clear the scene. But we'll park maybe a block away around the corner, and we'll get there without using our lights and sirens. So we're not announcing our arrival. We may drive past the residence, you know, there, police aren't on scene yet. And so we can see the front of the house, the sides of the house, things like that, gather as much information as possible about that scene in regards to our safety. Yeah, you really have to learn to be observant and trust your instincts, trust your senses, what you see, what you hear, maybe what you smell on the scene. That could tell you a lot of things about your own safety. Crime scenes we'll talk about. Look for signs of alcohol or drug abuse at your scene, in the room where you are, in the house. Any weapons, guns, knives, whatever it might be, laying out and about. You know, family members that are clearly agitated, they can be violent as well. So we have to be aware of these things. We have to be ready to walk out of the scene for our safety and call police for backup or to make the scene safe. Right? Our health and safety is priority number one. It doesn't matter if we're in that patient's house, if we're being threatened or we feel unsafe. We will walk out, and we will call our brothers and sisters that work for the police. They'll come in and make sure the scene is safe, and then we'll go in and continue our patient care. Right? Just because we've made contact with the patient, if we're not safe, you know, if we're feeling not safe, it's okay for us to walk out. It's okay for us to be safe. Right? It's not like we've committed 100% and we can't leave. If we're feeling unsafe, get out of there. Let's make the scene safe and then go back in. Perpetrators of crimes may still be there, so maybe they're looking at the crime scene there to, you know, maybe they hurt somebody, retaliation, and then maybe they'll go after us for trying to save that person on scene. So all the other people to be on the lookout for. Pets are dangerous too. They don't know what's going on with their owners. So always ask, always ask, regardless of the size of the dog or how nice the owner says it is, always ask them to put the dog away. In reacting to danger, we have to remember the 3 R's. Retreat, get away from the scene. Radio, call for help, let them know, let the dispatcher know what is going on, let them know what resources you may need, like the police. And then reevaluate the situation. Has it been made safe yet? Is it okay for us to go back in? Do we need to stay here? Do we need to get in the ambulance and stage somewhere else? So get out of there, call for backup for help, and then reevaluate the situation. And never re-enter a scene that is dangerous until it's been made safe by police. So you need to know your 3 R's: retreat, radio, and reevaluate. All right, so if we're really in danger, run, get out of there, flee. Drop any cumbersome equipment. Don't let some replaceable piece of equipment let yourself get hurt. Drop it. Who cares? Run. It can all be replaced. You just get out of there. Now we need to know what the difference between cover and concealment is. Concealing is what these folks are doing here. All right. It hides you from view. It hides you from view. Concealing. Okay. So a bush, for example, like these guys are behind, they're concealed from view, but they're not entirely safe. If a gunman were to shoot in that direction, obviously could pass through that bush and still strike one of them. So concealing is just placing an object between you and the perpetrator to make sure they can't see you. Let me go back one. Cover, on the other hand, cover is when you're behind something like a brick wall, something that could stop a projectile. So concealing is just hiding yourself from view. But taking cover is being behind something that can stop a projectile. All right, that is the end of our chapter there. Make sure you read, taken notes, come to class with any questions that you may have. All right. Thanks, guys. That's chapter 2, and I'll see you next for chapter 3.